American Heart Month, hence the little red dresses here. And every Wednesday this month, we are focusing on heart health with the folks from Bon Secours Heart and Vascular Center. This week's topic is off-pump coronary artery bypass graft surgery. That is a mouthful, but the man who can tell us all about it is Dr. Robert Lancey, cardiothoracic surgeon, and it's also called an easier one. We also call this beating heart surgery, right?
Yes.
Okay.
Good way to remember it.
Yep. Good way to remember it. Well, thanks for being with us, Doc. Appreciate
Thanks for having me, Stephanie.
So tell me, who are the people who come in for this kind of surgery? Is it mostly genetics or mostly people because of bad lifestyle?
It's mostly bad lifestyle. It's a disease that we know what the causes are. We know smoking, we know bad diet, we know lack of exercise lead to heart disease, but as Americans, we don't always follow the right lifestyle.
Right. All right. So then you're told by your doctor that you need to have a bypass surgery. Most people don't know much about either the beating heart or another kind, and it's usually not their decision, right?
That's right.
Okay.
That's right.
So how do you go about making the decision on who might get a surgery like this?
A lot of it depends on the anatomy of the heart. Well, how many vessels are blocked, how large the heart is, how well it's functioning. And in particular, the operation is quite good for people who have a lot of other illnesses, diabetes, high blood pressure, weak hearts, weak kidneys. Those folks benefit most from it, so we try to use the heart-lung machine on the healthier patients and not the heart-lung machine on the sicker patients.
Oh, okay. So tell me how this works. What's the difference between this and the regular bypass where you're talking about using the machine, for those who don't really know?
Right. Well, with the regular operation, we connect the patient to a series of pumps and tubes and oxygenator, and their blood leaves the body, comes through the pump, gets oxygenated, and comes back in. Without using the heart-lung machine, we actually let the heart continue to beat. We lift it up while it's sitting in the body, allow it to continue to perfuse the patient, and do the operation just by getting small parts of the heart in a stranglehold and almost paralyzing the area so that we can then operate on it. Without that, it's sort of like trying to change the carburetor of your car driving down the road. So we have to make sure that the heart is still in that area, but still beating and working for the patient.
I was going to ask, how difficult is that for you as a surgeon to work on an organ that is still moving?
Right. Well, we tend to think of it as an operation that will transfer the pain of the patient onto the pain of the surgeon. But it's well worth it. Patients recover faster. They seem to get back to work sooner. They're out of the hospital sooner. The lower rates of blood transfusions, heart arrhythmias, things like that. So it's well worth the pain.
Obviously. All right. Well, no offense, but we would rather stay off of your operating table. So are there any kind of exercises in particular or things we can do in our lifestyle that will keep us out of there?
Sure, and I tell my patients who come in, they don't want to come back and see me professionally, personally, maybe not professionally. We tell them 30 minutes of exercise a day is essential from that point moving on. Eating habits improved, no red meat, low cholesterol, low fat food. And for those that smoke, they know they're off smoking for good at that point. I tell them that they're not ex-smokers, they're just not smokers. They just don't do it anymore.
Now you say no red meat. So is that advice for everyone, or is that advice when you have a certain diagnosis?
No, it is for people with heart disease and with blockages in the heart vessels. It should be no red meat. As people are, most people don't follow it. So if I say you can have it once a month, they'll go to once a week. So if I say no red meat, maybe we can cut it down to once a month.
All right. All right. Well, we'll all try to be a little healthier and stay off your table, even though it's lovely to meet you, Dr. Lancey.
Great.
Thank you so much.
Thank you.
And Bon Secours Heart and Vascular Center, you can reach them at bshr.com. And, of course, they'll be back next week with us on Heart Month.